Good afternoon to you and welcome. This is Sunshine Report on Osrc television. My name is Oyewumi Ayinigbara. Ondo State's Governor Lucky Aiyedatiwa has sworn in new and returning special advisors, as well as the Director General of the Performance and Projects Implementation Monitoring Unit, PPIMU. The governor also inaugurated the Ondo State Law Commission. The ceremony held at the Cocoa Conference Center in the governor's office, Akure, marked a key step in reinforcing the state's governance framework under the ROE's policy agenda. Governor Aiyedatiwa described the occasion as a commitment to leadership centered on the people, efficient governance, and public service grounded in integrity. He explained that the appointments were the result of a thorough merit-based selection process, adding that the appointees are skilled professionals and devoted citizens who will contribute to good governance and the delivery of tangible benefits to the people of the state. Those sworn in as special advisors are Olugbenga Omole Transport, Gani Mohammed Special Duties and Strategy, Alan Showore Communication and Strategy, Sami Smart Francis Entrepreneurship and Innovation, Tunji Remer Environment, Kikelomo Ikwemola Public Affairs and Intergovernmental Relations, Wali Aladinusi Marine and Blue Economy, Kolawole Babatunde Legislative and Party Affairs, and Igbekele Akinrinwa Local Government Affairs. The governor urged the advisors to carry out their duties with humility, hard work, and responsibility. The Ondo State Law Commission was also inaugurated with Femi Okunjemiruwa named chairman. Other members include Rotimi Omoshua Raymond, Ogumoyero, Oladengbe, Sunday, and Tokwe Olajibe. The governor charged them with modernizing the state laws to be fairer, more effective, and responsive to changing social needs. Governors of the Southwest region have announced the establishment of a Southwest Security Fund. The fund, which is to be domiciled under the Dawn Commission, will be managed by security advisors from all 6 states. At an emergency meeting convened in Ibadan, Oyo State, to tackle escalating security challenges, the governor said the fund will support coordinated security interventions across the region. They also approved a digital real-time intelligence sharing platform that will allow the exchange of threat notifications, incident report, traveler and cargo alert, and rapid coordination of responses among the state. The governors urged the federal government to assist in deploying forest guards to secure the Southwest Forest Belt, highlighting the involvement of states in providing personnel. The Southwest governors expressed serious concern about unregulated interstate migration, calling for stricter border monitoring, biometric data collection, and closer collaboration with the National Identity Management Commission, NIMC. Renewing a long-standing demand, they advocated for the creation of state police, asserting that the time for this action has arrived. They commended President Bola Tinubu for his efforts against insecurity and various economic reforms and reiterated the region's unity and commitment to sustaining religious tolerance. Present at the meeting were Governor Lucky Aiyedatiwa of Ondo, alongside his colleagues Babajide Sanwo-Olu of Lagos, Dapo Abiodun of Ogun, Oyo State Governor Seyi Makinde Biodun Oyebanji Ekiti, and the Deputy Governor of Osun representing Governor Ademola Adeleke. And still talking on security, the Ondo State Amotekun Corps had announced that it has begun 24-hour patrols in border communities across the state. This move follows recent security breaches reported in various parts of the country. In addition to border patrols, Amotekun operatives have been deployed to schools with bordering facilities to provide improved security and surveillance. The Corps has placed personnel in border towns and outskirts of high alert to respond swiftly to any threat. According to Commander of the Amotekun Corps in Ondo State, Adetunji Adeleye, the heightened security measures come in response to current security challenges and the upcoming Yuletide period. Adeleye reassured residents of their safety. In the meantime, the Ondo State Police Command has arrested 2 students of Adekunle Ajashi University at Kongba Akoko over an alleged conspiracy and rape of 20-year-old student. Police spokesperson Olushola Ayolade confirmed the arrest in a statement, saying the incident underscores the command's strengthened capacity to tackle serious crimes. According to the police, preliminary investigation revealed that the victim was lured to the home of a longtime friend, Queen Sodo, a 19-year-old undergraduate of the institution. Ayolade said the victim, who had known Sodo since secondary school, accepted the drink later found to have been laced with drugs, rendering her unconscious. After noticing the victim had become incapacitated, Queen Sodo reportedly left the room, invited a male accomplice, and kept watch while the crime occurred. A neighbor, upon hearing unusual sounds, reportedly rushed into the apartment and found the victim unconscious alongside the male student, the suspect. She was immediately taken for medical treatment and later transferred to a specialist facility where she is now recovering. The police spokesperson said all the suspects have confessed to their involvement. In other news, Governor Aiyedatiwa has urged community collaboration on vigilance, and the Ondo State government says it will continue to intensify efforts to reduce gender-based violence to the barest minimum. Governor Lucky Aiyedatiwa spoke in Akure at the launch of the 16 days of activism against gender-based violence. Osrc's Zemo Ebiemi reports.
With the theme Unite to End Digital Violence Against Women and Girls, this year's 16 days of activism brought together top government officials, civil society groups, and private organizations, all united to combat gender-based violence in Ondo State. The call to action is backed by alarming statistics. Recent findings from national and international agencies show that 63% of Nigerians say they have either experienced or personally known someone affected by gender-based violence. Similarly, the Nigerian Demographic and Health Survey indicates that 31% of women aged 15 to 49 have experienced physical violence, while 9% have suffered sexual violence. In Ondo State, a recent survey revealed that 68% of respondents say they or someone they know experienced gender-based violence within the last 5 years, with 79% of incidents happening within the home. Governor Lucky Aiyedatiwa, represented by the Commissioner for Women Affairs and Social Development, Seun Osamaye, described gender-based violence as a major threat to the dignity, safety, and productivity of women and girls. He assured that the state government would continue to strengthen its response systems.
This is a critical case and a critical area that needs the support of every human being, both men, women, and children. Why? Because gender-based violence cases are cases that affect everybody in the society.
The governor called for collaboration in finding lasting solutions to the growing concern.
To illuminate and join the global world to say no to domestic violence, to say no to gender violence, to say together we are saying no to any form of violence against our children, against our girls, against our women. So we are gathered this morning, not just to run a campaign, but to speak out and speak loudly, to condemn in whatever form, any form of violence against our women and against our children. And this campaign is not going to end with just speaking alone, but also taking action.
The director of the Ondo State Agency Against Gender-Based Violence, Tunde Emorua, and the CEO of Restoration of the Dignity of Womanhood, Olabisi Omolono, stressed the need for survivors and witnesses to speak out early.
I want to advise our parents and our students, our student police, youth and youths here. what is the importance of this gender-based violence to us is doing more harm than good. We now discover that today this thing started from home. We discover most of the children, the wives, the women, the girls, after getting their unwanted pregnancy, majority of pregnancy were denied. Why? Because of the lack of culture.
We in Ondo State, we are very lucky that the women in the state, we are giving different skills for empowerment.
They also urged parents and guardians to pay closer attention to their children, warning that perpetrators are often within the community, sometimes even within the home. The global campaign will run until the 10th of December 2025, with Ondo State reaffirming its commitment to zero tolerance for violence against women and girls, whether offline or online. The wife of Ondo State Governor Oluwaseun Ayedatiwa will be leading the advocacy.
And after residents of Ilaramoki in the federal local government area of Ondo State alerted authorities to an 8-year-old boy named Sheyi hawking okra with chains fastened to both legs. The boy's father, known as Babaidori, was found to be responsible for chaining him. Babaidori explained that he did this to control the child's alleged misbehavior. The man has since been handed over to the police for further investigation.
That guy you get if they take you up now, somebody will carry this picture for you. I know this year. The God say, hello, sir. Tell your child. Hello, sir. Decide God say, tell your child. Hello. In normal way. Where go service for me? We case and spoil another person man. Again. I said, this boy, me said, don't tire. Now my wife now put me for this place now. This thing now. I don't live like water. I don't say they don't come. Wait. Your wife takes on you are from Idoli, you are not from Idoli. I'm from Idoli. You are from Idoli. Yes. If you are back to say you go to do all those things. All the things don't give me problem. Big boy. I go to for Idoli now. Can you do this one in Idoli where your brother will cut you? Wait. That is why you are stubborn. Can you do this one in Idoli? Make it on Mama side at Idoli. Go job money. What to get? Shake out test you. Bàbá wọn níbi ìgbà tí gbogbo ìmọ̀ tó bẹ̀rẹ̀ sílẹ̀ tí nígbà ọ̀gá àgbẹ̀jẹ̀ lọ́pọ̀.
Nigeria's First Lady Oluremi Tinubu has launched a national menstrual health project under a renewed hope initiative tagged Flow with Confidence, with the distribution of 370,000 sanitary pads to teenage girls across the country. At the ceremony in Akure, Ondo State capital, the wife of the governor, Oluwaseun Ayedatiwa, stated that Ondo State received an allocation of 10,000 sanitary pads to be distributed across the 18 local government areas of the state, particularly in rural communities where many girls struggle to access such products. Joy Pius now completes the story.
The Flow with Confidence, a renewed hope initiative put in place by the wife of the president, Senator Oluremi Tinubu, to promote menstrual health and hygiene among young girls, is benefiting thousands of schoolgirls across Nigeria. Launching the program in Ondo State, the wife of the Ondo State Governor, Mrs. Oluwaseun Ayedatiwa, said the initiative aims to empower and support 370,000 schoolgirls, particularly those in rural communities, who struggle to afford sanitary pads. She added that in Ondo State, 10,000 packs of disposable sanitary pads will be distributed across the 18 local government areas of the state, stressing that the pads are not to be sold under any circumstances.
In today's modern world, no girls should have to miss school because of our inability to afford sanitary products. It is unacceptable that our girls still continue to face significant challenges during their menstrual cycle, especially those in rural communities. For us, at the Renewed Hope Initiative, we believe that no girl should ever have to choose between her dignity and her education. The success of Flow with Confidence program depends on all of us. I therefore urge corporate organizations, parastatals and agencies, and well-meaning Nigerians to key into the Flow with Confidence program so that we can empower and reach as many girls as possible.
Commissioner for Women Affairs and Social Development, Dr. Shinwo Samaye, and the Commissioner for Education, Science and Technology, Professor Igbekele Ajibefun, among other stakeholders, commended the First Lady for her foresight and compassion in addressing the challenges of menstrual hygiene among schoolgirls and restoring confidence in them.
I am confident that today's engagement will further strengthen our collective resolve to promote menstrual health education, sustain support for schoolgirls across Nigeria, and build a nation where every girl can truly flow and glow with confidence.
The barriers that will stop the girl child to get to the highest level is being removed through different programs of empowerment. And women who will continue to support every program that will empower the girl child. So I want to congratulate Ondo State that in this direction we are doing very, very well.
Now to thank Her Excellency Senator Remi Tinubu and also Her Excellency Oluwaseun Ayedatiwa for bringing out this menstrual flow opportunity for us to gain over 370,000 pads are distributed to girls all over Nigeria. That is a great opportunity for all girls in Nigeria, most especially girls that are empowered through education.
I really thank them for empowering girls on mental health and how to take ourselves during menstrual flow.
The Flow with Confidence program, which focuses on menstrual health and hygiene for schoolgirls, aims to provide a one-year supply of disposable sanitary towels to thousands of schoolgirls across Nigeria. Joy Pius, OSRC News.
Meanwhile, lack of sanitary pads and other menstrual products for young ladies remains one of the silent crises affecting education in Nigeria, particularly in rural communities. The inability of many girls to afford or access sanitary pads forces them into unsafe menstrual practices, affecting their health, confidence, and school attendance. Blessing Obi reports on the hidden struggle many girls face every month and the efforts to support them through a natural process that should never hinder their education.
Every month, millions of girls across Nigeria menstruate. Yet, for many, this normal biological cycle becomes a barrier to learning. According to UNICEF, over 25% of schoolgirls miss classes during their periods due to the lack of sanitary product and menstrual hygiene facilities. On average, a girl menstruates for about 4 days and changes her pad 3 to 4 times daily. This requires no less than 800 naira per cycle, an amount many families, especially in rural areas, simply cannot afford. The result is a silent crisis. Girls turn to rags, old cloth, tissue paper, cotton wool, and other unsafe alternatives that expose them to infections and deep embarrassment.
We have so many girls, when they are menstruating, majority of them don't come to school due to lack of sanitary pad. Girls should work with confidence. When they are menstruating, with pad with them, they will be able to walk to school confidently.
Majority of the students, they don't have access to this sanitary pad. During their flow, some of the students, they will stay back at home because they don't know what, they don't have what they will use. Maybe they use rag, so they will even be ashamed. They will be ashamed, or maybe so that they will not be stained. So they decided to stay back at home. They will not come during their, and some will not even be free. They will not be free. They will see them that they will withdraw to themselves during their flow.
A parent, Bola Adedeji, said beyond absenteeism, the emotional toll is heavy. Girls report reduced self-esteem, fear of staining their uniforms, and the constant worry of being mocked by classmates. These challenges limit their participation in school and community life.
The major challenges that I can feel that these children are having is a kind of non-relationship between the girls and the mother. If a girl child is having a close monitoring between herself and the mother will know the actual time and period that her child is on her menstrual period. I am speaking on this issue from the fact that I had similar experience. During my youthful day, I couldn't express myself to my mother. I was feeling feeling ashamed of telling her that I am now having a menstrual flow with this. Because of the fact I couldn't tell her and I don't have money, I have to be using tissue paper and rags to keep myself until one day she saw me. But if I pupils are me and the children are able to express themselves, and the mother as a parent, you are having a kind of relationship with your child, you will know when and what to do at a particular point in time for them to keep them safe.
Non-governmental organizations say the root of the problem goes beyond poverty, pointing to weak policy implementation, lack of menstrual education, and poor toilet facilities in schools.
There are things that are choices and there are things that you cannot overemphasize. Number one, condoms are being subsidized in Nigeria. Sex is a choice. Menstrual pads are supposed to be subsidized or even given free. Government should make menstrual pads accessible for indigenous girls.
Despite stigma, pain, and limited resources, many girls continue to show resilience, attending school when they can and managing their cycles with whatever they can find.
Having menstrual pain is not a crime, it's just a right. It's not a sin having a menstrual. Menstrual cramps does not have to stop me from partaking in different activities I should be involved in. So I just need to put myself together and just go on with life and continue with my daily activities.
In recent years, both federal and state governments have introduced free sanitary pad programs, but experts warn that ending period poverty requires more than distribution drives. It demands affordability, menstrual education, and community support. Period poverty remains a hidden struggle, but not an unsolvable one. With stronger policies, public awareness, and consistent investment, Nigerian girls can learn, participate, and thrive with dignity every day of the month. Blessing Obi, Osrc News.
Over 1,300 residents of Ondo Kingdom have benefited from free eye treatment as Iroyin House of Hope continues its annual medical outreach for people with sight challenges. Founder and chairman, Mr. Akim Oyinei, says the beneficiaries form part of more than 2,000 registered patients for this year's program aimed at tackling blindness, cataract, glaucoma, and other eye-related conditions. Adewumi Taiwo reports.
It is another edition of the Special Eye Care Outreach, a vision of hope for many who depend on this annual intervention. Since its establishment in 2019, Iroyin House of Hope, based in Ondo Kingdom, has continued to place the welfare of the elderly, widows, and vulnerable groups at the center of its humanitarian work. Working in partnership with Eye Foundation Hospital, the organization provides free eye care services, regular medical checkups, and social support for residents who cannot afford medical treatment. Giving more insight, the founder, Mr. Akim Oyinei, explained that over 2,000 patients were registered ahead of the outreach, with about 1,300 to 1,400 already receiving adequate medical attention. He reaffirmed his commitment to ensuring that every patient gets quality care, noting that his passion was inspired by the experience of his late mother, who suffered a preventable eye condition due to lack of timely medical support.
We give them free medication. We give medication for arthritis, for hypertension, for diabetes, malaria, and what have you. But our operation is strictly meant for the widows, and because they are forgotten people in the society, so it's strictly for women, widows, and elderly. Okay, so, and we also do physiotherapy as well, for those who are registered. Like I said, we have 400 patients that come in, so 100 at a time.
Program Manager at Eye Foundation Hospital, Dr. Emmanuel Ogundare, highlighted the range of services rendered and emphasized the importance of sustained community-based medical outreach.
The pattern is to set up a date to have a pre-registration for the event, and then about 1,300 eventually registered for the event. And so they were all sectioned in 2 days such that it could accommodate each and every one of them, as much as not overburdening the staff rendering these services. And so it's going to last for 4 days, Monday through Thursday, and then the turnout has been great. And then even the turnouts being great is a function of the testimonies that have encompassed the whole program.
Some beneficiaries expressed gratitude to Mr. Oyeneyin and the medical team, describing the intervention as timely, life-changing, and huge relief for families struggling with the cost of eye treatment.
They gave me free. They gave me glasses, they gave me eye drop for eyes.
By delivering essential medical care to those who need it most, the outreach continues to strengthen public health and improve the overall well-being of residents across Ondo Kingdom. Adewumi Taiwo, OSRC News.
And with that story, we conclude the Sunshine Report on Osrc Television this afternoon. We say thank you very much for watching. Enjoy the rest of your day.